everyone. Welcome to the next webinar in our series ahead of the Healthspan Show running next month. We've got a real treat for you today. I'm very, very excited to bring the team from DSM and Hologram Sciences together to talk about how to deliver a personalized nutrition platform that delights consumers. Before we get underway, I'd like to just make a couple of tech points. We're really excited to have so many of you signed up for today's webinar. If you'd like to correspond with one another and other viewers who are watching, please just use the chat to do so. If you have questions for the presenters throughout the session, please make sure you use the Q&A. That's the best workflow for them to follow your questions and to be able to address them in a coherent manner. But without further ado, I'm going to hand over to your moderator for today's session, James Bauly, who's Head of Personalised Nutrition at DSM. Thank you, James.
Thank you, Angela, and hello to everybody. Good morning, good afternoon, wherever you are. It's a great pleasure to be talking to you today and really looking forward to sharing our story around personalized nutrition. We're going to be delivering that to you basically in 3 chapters. The first part will be about our strategic journey in personalized nutrition over the last few years. How did we get where we are today? And Ian Brady, CEO of Hologram Sciences, is going to be taking that part. We will then segue to Laura Artigas, our Chief Commercial Officer at Hologram, and she's going to be diving more deeply into the playbook for winning personalized nutrition consumer brands. And that will then transition to me with the last few slides to close the presentation, where I'll be outlining opportunities for collaboration with us in projects as we go forward. So after that, we will have a live Q&A, which I will moderate, and really looking forward to hearing your questions. As Angela said, please don't hesitate to keep them coming through the Q&A function. And so with that, I'd like to hand over now to Ian to take us on the first part of our journey. Ian, over to you.
Thanks, James. We can kick off with the slides. Thank you, everyone. A pleasure to be here. As James mentioned, I'm Ian Brady, CEO of Hologram Sciences. I wanted to share some context in terms of DSM and Hologram and how that fits together. DSM has had a history in personalized nutrition going back to 2017, and over the years has made a number of investments and strategic partnerships, mainly around areas of diagnostics and delivery systems or product formats. More recently, the emphasis has been more towards digital, partnerships including wearables, and also via the acquisition of Ava, an AI-based digital nutrition platform, of which I was the CEO for. More recently, we're excited to announce the spin-out of Hologram Sciences, which really combines a number of these initiatives together into a new company that we're going to talk about today, and in the context of how to launch a personalized nutrition initiative. So DSM works with a wide variety of customers across food and beverage, CPG, retail. And when we discuss personalized nutrition, I'd say over the past 12 to 18 months, there seems to be a number of common themes that we hear and see. We talk to a lot of CEOs at these organizations. I think they all understand the value of personalized nutrition, but often it's difficult for them to embrace at a very small scale. You know, you can talk to a head of, say, global strategy or M&A. Maybe they're looking at this slightly more transactional. And I think what they find is that, you know, while it might be opportunity to acquire new brands at $150 or $200 million, it tends to develop more of a wait and see approach, right? More resistance to think about experimenting and starting things early stage, would rather wait and are willing to pay a premium for that once it's been validated and proven. And oftentimes you may see teams who are very motivated to try to do things and experiment, but often struggle, even if they're successful in terms of what their metrics are, often struggle how to bring these up into an organization at a scale that is relevant given the size of these companies. And oftentimes those are underfunded and really hard to plug into what they think is really core to the overall strategic initiatives of the organization. Where we think that's an opportunity is there a way for us to create a new initiative, a new structure via Hologram to allow companies to explore these concepts, be a little bit more experimental, essentially look at ways to reduce the risk of their capital investment, reduce the risk of maybe not having the core competencies in-house, or even reduce product market risk where a new entity could go out and figure out where that product market fit is before they bring it into the organization. Next slide. And that's the mission for Hologram. We want to help companies validate personalized nutrition opportunities. We have the ability to build end-to-end brands around various health conditions and consider how diagnostics, digital platforms, and various product formats can best serve consumers around a single solution. We invest our own capital. That could be through partnerships as well, but we have all the core competencies to do this and move quickly to take on that early risk and to find strong product market fit. And I think really another way to think about this is complementary option for innovation or R&D strategy. We want to be able to sort of take a step away from an organization and focus on speed and agility. And as we de-risk the proposition and validate in the market, have the opportunity to bring it closer and closer to your respective organizations. Ultimately, we think this model will allow companies to explore new solutions more quickly and more effectively and act as a single stage license or M&A channel for them. Next slide. So with Hologram, the way that we bring these together, as I mentioned, is really across various building blocks. It starts with research and consumer insights. We might be interested in, say, motherhood or prediabetes or something around menopause. And we want to figure out what are the unique insights that we can build off of that's going to make a difference to a consumer. But then we have the opportunity to plug in various pieces that we have access to, right? We can build a brand around this. We can think about technology powering the recommendations within that system. We think about the different retail channels that may be appropriate in terms of how we bring this to market and what a phased approach may look like. And then ultimately plugging back into DSM, we have nutrition science in terms of the nutrient recommendations and product recommendations that we're making. And those can be across various delivery formats. We're sort of agnostic in that area. We want to have formats that we think will provide the consumer with the best experience. That may be one format, that may be multiple formats, depending on the health condition. Next slide. And as an example of that, we're excited to announce our first brand under the Hologram is a company called Develop. We've launched this Tuesday. This is a holistic community brand focused on vitamin D. It includes an at-home blood test. It has digital feedback through a native app that can be downloaded. That app has conversations around things like diet, sleep, exercise. It recommends various products to help people feel more secure in their health as they step back into the world. From concept to launch, getting Develop out into the market took us 80 days. And this is well beyond just a basic website. This is a dedicated, essentially legal entity, has full direct consumer advertising and e-commerce capabilities. It has our own quality control process for our products, has end-to-end logistics and fulfillment. So everything is sort of end-to-end completely ready to go. And the idea is that we will now grow and scale up, Develop in the market over the next few years with our own capital and validate that it works, figure out how to expand the product options and offerings that are available beyond just vitamin D. And we think that immunity is a topic that will be of interest for a long period to come. We know it takes time to build these brands, right? But the speed to market, our ability to move very quickly, getting it launched, allows us a certain degree of experimentation to really figure out what works and make the necessary adjustments as we continue to invest in building the brand. And what that really looks like for us is that, this is a scalable model. We want to take companies like Develop and do it 1 or 2 or 3 more times this year and get up to a cadence where we're building a roadmap of direct consumer brands focused on various health conditions. We'll launch a few of these per year. We also think, though, that behind the scenes, there's probably about 60 to 75% of this is shared infrastructure. All of the behind the scenes capabilities allow us to scale this across multiple brands and move pretty quickly. As I mentioned, we'll continue to invest and grow these brands as they become more validated in the market. The risk profile is reduced. So the idea is that we work from left to right? We come up with the concept, we launch it. You can see where Develop is, and then we continue to sort of de-risk that as it gets more mature in the market. And as we do that, the brand premium increases. And what this allows companies to think about is, where do they want to engage across various stages of risk? They could come in on an earlier stage and thinking about licensing. They could wait until something is really de-risked and shows a very strong operating company in terms of unit economics, revenue, customer engagement. And they might want to think about that as an M&A opportunity. So for us, this is now a pipeline for us to continue to launch and build these brands and then grow them in the future. And then finally, from my side, I'd like to talk about behind the scenes. There's really core to this all as a digital platform. It took us over 3 years to develop this as part of the Ava company, and it can take a substantial amount of inputs across nutrition, health, wearables, biomarkers, and make very sophisticated recommendations based on rule sets that are applicable to certain health conditions. These then recommend whole food diets, lifestyle recommendations, products in the form of whole food diets, vitamins, supplements, et cetera. It also includes coaching to help drive overall engagement. And this backend really allows us to scale the overall service offering without a significant amount of new investment. And in addition, it can be really tailored to general wellness, to more chronic health conditions as necessary, and where we see the opportunities. And to speak more about how this fits into, I would call a sort of new style of playbook, I'd like to hand it over to Laura Artigas, Chief Commercial Officer for Hologram.
Hi, everyone. As Ian said, to execute against this vision, we've developed a repeatable playbook for selecting, designing, launching, and then scaling these new brands. And as Ian also mentioned, it all begins with insights. We collect secondary and primary research on the conditions that we're interested in, combine with DSM innovation and intelligence with a view of the market landscape to make our selection. Go back one more slide. The design process is heavily consumer vetted as well, with feedback collected along the way, both from self-reported responses as well as live in market experimentation to see how consumers actually behave when presented with a concept. The launch period is more than just a moment in time, but actually more like rolling thunder as we experiment, warm up the accounts, run rigorous A/B tests, and onboard press and influencers and others to help spread the word. And then by closely monitoring the KPIs in the launch phase, we can make a determination whether to double down and grow a brand or hit the pause button to make further adjustments before investing further. Now you can move to the next slide, thanks. So specifically during this initial selection process, we take a structured approach to evaluate who, where, and why. Who the consumer is and what their needs are, what they're not getting today. Where can we access solutions by exploring our DSM pipeline, as well as what white space opportunities exist in the market? We come out of this first phase very clear on our why. What are the problems we're trying to solve? Then we design all of our solutions to include 3 components: diagnostics that help personalize the solution, digital coaching and feedback for engagement and further personalization of the experience, as Ian spoke about with our Ava platform, and supplement products. Our first launch of Develop is a great case study just this past Tuesday for this rapid innovation process. Tapping into the growth of concern with immunity and the unique calcividiol product from the DSM portfolio, we saw the opportunity to bring a premium product that's differentiated vitamin D to market with a diagnostic and digital support. The Develop brand includes an at-home vitamin D test kit, which is free with subscription, a holistic immunity app with coaching for lifestyle recommendations like sleep, diet, and exercise to help boost your personal immunity score, and vitamin D that's 3 times faster and 3 times more effective than regular D3. And it's available now at developimmunity.com. You can check it out after the session. The test comes as a 2-pack, so consumers can test before and after starting their Develop vitamin D to see the results. Those results come straight into the app with dietitians standing by to answer questions and make further personalized recommendations for immunity boosting lifestyle and diet habits. The Develop brand helps people feel more confident about their health as they're stepping back into the world and starting to open up again. I'll now pass it back over to James to share more about our roadmap and partnership opportunities.
Thank you, Laura. I'm just going to restart my video here. So thanks, Laura and Ian. Great segue, really, just to share with the audience also a little bit forward thinking. Firstly, on the roadmap for further brands that will be coming through the pipeline. And then with that context, what are the partnership opportunities? So this slide really demonstrates our thinking in terms of the next few steps in the pipeline of brands and concepts. We've been talking about develop, and as Laura hinted, having launched develop, the process doesn't stop there. In some ways, the launch of the develop was the end of the beginning, and now there's still a lot more work to do with develop in terms of growing that concept, building out additional features in the consumer experience, potentially bringing in other diagnostic opportunities, and certainly further developing the variety of products that are on offer to give consumers a choice of different product formats. So that obviously is going to be still quite a bit of work to do, going through certainly the rest of this year for develop. Now, in parallel, of course, we have this ambition as we want to launch several brands per year. We need to be working on the next one as well. And you can see that here, we've called that Nuco 2. And it's very likely that that's going to be in the space of women's health and motherhood. And this is perhaps a good moment to hint at opportunities for partnership. You know, given that women's health and motherhood is such a complex space, we're also looking to work with a partner on bringing that concept forward, right? And then there will be a third brand that will be developed as well. It's probably a little early to be talking about that in detail right now. As you can appreciate, we're still a fledgling team, so got our hands pretty full, but suffice it to say that there's a lot of research and concept testing that's been initiated and going on in the background to start to get the ideas in line for Nuco 3, for brand 3. Okay, so with that overall pipeline in mind, we wanted to share with you a little bit of some options for potential ways of collaboration. And what we've done here is really just take a little bit of a step back and firstly look at it from a higher level, from the context of the total DSM family, if you like. And so if you start on the left-hand side of this slide, many of you will be very familiar with the typical DSM offerings around ingredient solutions. So a long track record of supply and manufacture of quality ingredients, including proprietary ingredients or hero ingredients, as we call them. And that's something that DSM absolutely will continue to offer. Also to brand owners, say, that perhaps already have an existing personalized nutrition platform. And we're already supplying ingredient solutions into such platforms. The middle part starts to signal a little bit the evolution also from a DSM perspective in the sort of overall strategy towards a more solution-based model. And what we have in the middle part here is what we call market-ready solutions as an illustration. So an example of that would be, instead of a single ingredient, getting from DSM a fully finished product, right? Unbranded, so what we would call a white label product, but something that a brand owner could basically apply their brand to and then put on shelf. Okay, so this is an example of where DSM is taking on more of the complexity and the risk and de-risking and decomplexing for the brand owner. And then, of course, on the right-hand side is really what we've been focusing on today, which is the Hologram Sciences part. And you could consider that in this context as a brand-ready solution. So here, Hologram, as we've talked about, is developing fully formed brands with all the necessary infrastructure and features that requires, and then launching those into the market direct to consumer to demonstrate commercial traction and success. And then ultimately, as Ian talked about, those incubated brands, if you like, would be made available through partnership opportunities, for example, licensing to our DSM customers. And so on the final slide, what we would like to do is just illustrate two possible examples of collaborating within the hologram framework. And you can see that here. On the one hand, we talk about what we call investment partnerships, right? And I hinted at this a little bit on the motherhood and women's health example. So this is something where perhaps there's a very large use case or complex use case where it makes sense to partner up. Both hologram and the partner would be investing into this use case. So it's a participative collaboration. Hologram would be doing the heavy lifting on actually creating the brand and the features and the product. And of course, the partner would also be collaborating on key decisions and perhaps supplying their own market insights or consumer insights or channel expertise into that partnership. The second example that we've got here is geared more towards retailers. So we call that a retail partnership. And that could be, as an example, that could be where we make available for example, Develop or another brand that Hologram's designed and launched, make that available to a retail partner to put on shelf or to develop an omni-channel strategy for that brand together with the retail partner, potentially look at adjacent spaces for the retail partner if they have their own in-house brand or other use cases that they're looking at, and then really working together on promotion of those different SKUs. So that's really just a little bit of in a nutshell, couple of opportunities for collaboration with Hologram going forward. A very quick pitch, if you're on the call and you have questions about that, don't hesitate to drop me a line to initiate a conversation. We'd be delighted to hear from you. So that actually brings us to the end of the webinar content in terms of presentation. And what we'd like to do now is really open it up to Q&A. Now, I'd just like to make a bit of a pitch. Don't be shy on the Q&A. We would be delighted to receive your questions and very happy to answer them. I've got a few here that we'll kick off with. So do keep them coming in. And maybe the first question, Ian, I think for you is just a little bit tongue in cheek, but share a little bit about the inspiration for the name Hologram, where that came from, what that means.
Yeah, I think for us, obviously Hologram is a parent company, right? We're going to be a builder of brands. James, I think you used the word incubator, right? That's another way to think about it. But Hologram is behind the scenes, right? This is all about creating consumer-facing brands and helping partners develop those brands. So in that context, I think Hologram sort of represents all of this world around sort of 2D data presented in a much more 3D world. And so, we'll be behind the scenes projecting out what we think these brands can be like.
Very good. Thanks, Ian. And Ian, while I've got you, another question here. You mentioned the speed actually with which you've develop. And 80 days, I think you said. How on earth were you able to do that so quickly? Just maybe share some insights on the secret behind that.
Yeah, I mean, obviously there's always certain ways to think about bringing something to market. Speed is one, right? Quality and cost are obviously also very important factors when trying to do this. But for us, obviously, we think that there's a market opportunity that warranted us to move very quickly. I think our ability to do so is based on having all the core competencies in-house within Hologram. So we have a nutrition science function, we have a development function, we have a product development function, we have a marketing function, really strong on consumer marketing. We can bring all those together and make very, very fast decisions. Now, do I think every brand that we create will be done in 80 days? No. Obviously, as you mentioned, some are much more complex propositions that we really want to spend time thinking through the right insights. There's a high level of experimentation to figure out what will work even before going to market. And then going to market, there's obviously a continued sense of experimentation. So on average, I think, again, we might be at a cadence where we can do 2 or 3 brands per year. But speed is obviously going to be an important factor.
Very good. Thanks, Ian. I've got another question here. Actually, I can take this one. It's regarding raw materials. And so, where are the vitamin tablets, for example, coming from? Are they produced in-house by Hologram, or are they bought ready-made? I can share a little bit about that. So, Hologram's in the unique situation that it's backed basically by DSM. And as I mentioned, DSM has a very big legacy in raw materials, in ingredients, and in even in manufacturing of finished products. So for the most part, where it makes sense, where it's possible, where it fits the portfolio, Hologram can draw on DSM as a supplier of the nutritional products. But equally, Hologram also has the ability to go outside of DSM, potentially for other ingredients that are not yet part of the DSM portfolio. So I hope that answers your question. So then, starting to get some more questions coming through here. Laura, this is probably something for you, a bit of a question on, it's striking that you're focusing on like particular conditions, and maybe just reflect a little bit about the balance between focusing on a particular health condition versus a kind of a more general personalized nutrition approach. What are the insights that you see there?
Sure. Well, as I said, we always want to be clear on our why. What are the problems that we're trying to solve? And in a more general health and wellness context of personalized nutrition, if you really drill down into what is the problem, kind of general health and wellness approach might be trying to solve, it could be something like, I don't know which vitamins I'm supposed to take, or I don't know where my diet is deficient. And it's just kind of a broad question. And we believe that there's a ceiling for relevance in that case. There are only so many people who have that kind of burning question. Instead, we as humans tend to think a little bit more along the lines of conditions. We don't say the word condition, but we think, I want to lose weight in order to avoid becoming diabetic, or I want to lose weight for lots of other reasons as well. Or I'm struggling with motherhood, trying to conceive, or dealing with a pregnancy, or dealing with nutrition of my baby and nursing. There's more relevance when you take that more condition specific approach versus kind of generally, how can I be healthier? At a global level, certainly we see health trends are not looking good, but if you want to make it relevant to that consumer, bring it to meet them where they are, which is a bit more specific.
Very good. Thank you, Laura. Ian, probably another question for you. We've got a question here from Nick. Can you address, or you may maybe expand a little bit on the geographical regions, right? So US, North America, initial focus, and then global reach, and then specifically velocity towards emerging markets.
Sure, James. Yep. So given the fact that we have a strong digital component to this, that is based on native English language. So there's some constraints this year, I would say, in focusing on US. We have initiatives in the UK as well as Singapore underway. And I think we'll be strongly considering multilingual support, which unlocks, I would say, new opportunities, markets, and territories, probably in the, I would say, second half of next year.
Very good. Thanks, Ian. Good. I have another question here from Tim. It's a great question, Tim. Will Hologram move into a one-to-one level of personalization as opposed to marketing to broader cohorts like women's health? And Tim, I guess there's no single answer to that. It's a fairly complex matter. So the technology certainly exists to move into a one-to-one level of personalization. So through the technology partnerships that we have in-house and in our broader ecosystem, it is possible to offer personalized products down to the level of what we call n equals 1. So for a particular individual, and quite often, when we go down that road, it will still be within a broader cohort. Right, so an example of that might well be for pregnant women instead of offering a standardized multivitamin, we would offer an individual pregnant mum a specifically tailored nutritional product for her needs. So there's still a cohort, but the technology exists to do a very specific personalized product. And that's absolutely one of the topics that we go into quite some depth with that as we develop our playbook for a particular brand. Great. I've got another question here for Ian. Ian, would you like to expand a little bit about, obviously you've talked about immunity, launch, develop. How do you see actually COVID as having been potentially a driver overall in the space? How has COVID changed things for digital marketing, personalized nutrition?
Yeah, that's a great question, Jay. I think, it's obviously, I think, made personalized nutrition more topical, right? And something that I think people are thinking about quite often, right? Whether it's around obviously vaccinations, but more broadly speaking, what's the world going to look like over the next few years? How do we think about getting back into travel again, getting back into schools? And what does normalcy start to look like? So with that, I think it's I think raised awareness around how personalized nutrition offerings could be beneficial, I think, which is somewhat of a net positive. I think from consumer trend standpoint, though, there's also other factors, particularly when you think about e-commerce and direct to consumer, right? The bar is raising quite substantially on that side. I think obviously there's a major shift over the past year with more people being more comfortable with e-commerce. We see larger baskets or larger orders, less frequency. There's, I think, a more generalized focus around health and hygiene. I think the idea of getting access to expertise on demand is now becoming quite a thing. And even almost the concept of like an e-pharmacy at scale, right? The barriers to get access to these people and these products, I think, is going down very, very quickly. And the expectations are there that these things will stay. So I think, though, the challenge is that it raises the bar. When you think about going direct to consumer, you have to think about not just a single SKU or a few SKUs. I think the expectation now is that it has to be a more holistic offering. A year ago or 2 years ago, it was really early adopters who may have been willing to go to one brand for a diagnostic, one brand for some products, another brand for maybe digital and coaching. Yeah. And now I think that it's a shift towards more of a mass market that has expectations around convenience. They want to press one button and have a kit sent to their home, press another button and have access to an expert, right? And have another button and figure out what is the best product for them. Even to your point, James, if it requires a custom formulation, getting it down to that N of one. So it's, I think, a much more challenging game, but there's still quite a bit of opportunity.
Very good. Thank you. And everyone on the call, we've still got a few minutes remaining for a few more questions, so do keep them coming. Got a question here from Raya, who's just asking, regarding specific attributes or aspects that we're looking for in a partner. Ray, you're asking about women's health and motherhood, but I can also talk about partnerships in general. We already in both on the sort of under the DSM umbrella and together with Hologram Sciences, we already have quite a healthy ecosystem of partners. There are innovation partnerships in the space of wearables and tracking devices, and also innovation partnerships in terms of technology for designing these customized products that are able to deliver an N=1 nutritional experience. In terms of, what's the application process or how to get involved, as I mentioned, feel free to reach out to me to establish an initial conversation. And typically, of course, some of the things we'll be looking for is novelty and ability to differentiate and strong novel technologies. Right, sorry, just screening down here. We have Walter asking a question, and Ian, probably that's one for you. A little bit about the coaching. So how do you organize access to experts? are you using AI or warm bodies? Is it more a call center type? Maybe expand on that a little bit.
Yeah, sure. So right now, what we call experts for Hologram is nutritionists and dietitians. And we have over 150 within the US and the UK on our platform that can cater to a variety of different health conditions. We have essentially a routing system behind the scenes that gets all the interactions to the right pool of coaches, depending on the health condition, the expertise that's necessary, the credentials that are necessary. But that's a very scalable framework. And I think, as we develop new brand solutions, we will probably continue to expand out that network of experts, whether it's to address things like fertility, for example, or if we want to diversify the what we define as experts, right? Can we go beyond nutritionists and dietitians into potentially, medical professionals, or even if we're thinking about athletic performance, right? Is there other fitness professionals, right, or training professionals that we can loop in? And again, we use the word holistic a lot, but I think that's also how we think about the sort of digital piece and feedback loop, is that when you want to give people, I would think, a much more practical yet holistic offering and connect them with those expertise throughout the day, who they need to connect with is going to change. And we want to be able to help facilitate that as much as possible. And when you do that, I think you can drive engagement, right, which helps the brand overall, potentially helps with products in terms of understanding those products or buying those products. So it's an area that I think we're very excited about.
Great, thanks, Ian. And then changing tack slightly, a question from Dina. I hope I pronounced your name right. And maybe I'll hand that to you, Laura. This is asking about how we see brain health as an opportunity. Is that a new code looking at brain health, or perhaps part of another concept? Any insights there, Laura?
Yeah, absolutely. Brain health is definitely a category that's on our short list of categories we're interested in. Probably won't be new code 2 or 3, as you saw on the roadmap exploration from James. But we are thinking of that category as a possibility for 2022 next year. We need to dive in a little bit more on the kind of attractiveness of brain health. There are a lot of signals that it would be a very attractive category for us, as well as our ability to win, which again, we also are seeing several signals that we have a good chance of succeeding in that category. So looking at maybe latter half of next year or early 2023 to tackle that one.
Very good. And Laura, thank you. And while I've got you, a little bit of a similar question from Reed regarding professional and elite athletes and how you see the opportunity there.
Absolutely. Yeah. That is a cohort that is very interested in personalized nutrition. We hear about this cohort all the time as we speak to innovation partners who are, as James has spoken about, working on that down to that one-to-one level that I think almost across the board find a core consumer in these elite athletes and athletic professionals. So that is an area that's also kind of shortlisted as a category we could explore. I think it comes down to kind of that market analysis side of the Venn diagram to understand how we would be different from potentially the host of partners we already have that are serving this cohort, to meet them where they are. Are their needs unmet with so many solutions that are coming to market right now, and how big is that opportunity of the cohort? But it is definitely an area that we're exploring.
Thank you, Laura. Really appreciate the insights there. And I see that meanwhile, some of the other questions have been answered. So I think we're also answering some of these questions offline via the chat. So I think that we're probably good. I'd like to perhaps give the last word to Ian before we close, and just Ian, allow you to sort of reflect a little bit on the journey so far, and what excites you most about the next steps that as we go through the hologram and the various brands, that adventure.
Yeah, I think, I think what excites us is probably the most challenging area, which is building consumer brands is very hard, right? And I think it requires investment, patience, competency. So, we're very excited to step into that riskier area and do this. But I think the idea is that we just won't do this alone. It's not for just Hologram's benefit. This is really, I think, tying it back to DSM is how are we evolving what DSM's offerings are to partners long-term. And if this can help partners think about a way to decouple a piece of their innovation strategy or to accelerate a timeline for around a certain health condition like brain health, I think that's what allows us to, I think, move so fast and get more excited about this. So again, partnerships is key to our overall strategy. And it's something where we hope we can have a number of different conversations, with various partners to address conditions and ultimately help people at the end of the day.
Ian, thank you. That's a high note to go out on. Really appreciate it. Ian and Laura, thanks so much for answering all those questions. Audience, thank you so much. I think we're going to close it here. And just before we do, I will hand it back to Angela for some closing remarks. Thank you so much.
And thank you, James, for wonderful effort with moderating. Thanks to our excellent panelists, and of course to all of you for watching and being so proactive with your questions. Look, if you've enjoyed today, we'd love to see you back at the Healthspan Show in a couple of weeks. We're really excited to be hosting DSM and Hologram there as well, and talking a little bit more detail about personalized nutrition, as well as supplements and a whole host of other healthspan and nutrition related topics. So I'll put a link in the chat if anyone would like to sign up. If you're not already coming, you'll also be able to use the platform to connect with the DSM team as well if you've got follow-up questions. But in the meantime, thank you once again to our panel for an excellent and insightful discussion, and of course for leading the way in this space. Bye-bye for now.